everyone, my name is Adeline Barrington, and I am a Research and Health and Fitness Coordinator at the UPMC Hillman Cancer Center here in Pittsburgh, Pennsylvania. I will be walking you through 4 different functional assessments that you can use to test your balance, endurance, upper body strength, and lower body strength. For these assessments, you will need comfortable athletic clothes with tennis shoes, a chair, a dumbbell or household item for bicep curls, and water to hydrate in between assessments. Just a reminder, we want to make sure you are as safe as possible during these assessments, so please feel free to pause, rewind, or fast forward at any point during this video if I am moving too fast or slow. Our first assessment is the balance assessment, where it measures your capability of balance. We will establish safety precautions, explain how to complete the assessment with the correct technique, allow you to practice proper technique, and then you will time yourself to complete the assessment. This balance assessment is broken up by a 10-second balance hold, take a break to reset and explain a new position, and then repeat. There will be 3 different balance positions where we will hold each position for 10 seconds. We ask that if you have fallen in the past month or need assistance to stand, that you sit this test out for your safety. Safety is our number 1 priority, and we want to make sure that you are as safe as possible while completing these assessments at home. Just a reminder, if you are choosing to record your results, for each balance position, you will write either yes or no if you held it for the full 10 seconds. For the first 10-second balance position, you will stand normal, but with both the insides of your feet touching, just like what is shown on the screen. You can hold onto a chair or countertop before the 10 seconds begin if necessary to keep yourself steady and to be safe. Go ahead and move yourself into this position, and we will begin the 3-second countdown and 10-second timer. Awesome job on that first balance position. For our second 10-second balance position, we will bring both our feet together, just like in the first one, so that the inner part of both of our feet are touching. But this time, we are going to slide one foot forward so that one foot's heel is lined up with the middle of the other foot. If you look on the screen, there's also a picture to show you what your feet should look like. It does not matter whether you slide your left foot or your right foot forward. Go ahead and move yourself into this position, and we will begin the 3-second countdown and 10-second timer. Once again, you can hold onto a chair or countertop before the 10 seconds begin if necessary to keep you safe. Awesome job on that second balance position. For our third and last balance position, you will stand with one foot's toe to the other foot's heel. Your feet should be in a line, and it does not matter which foot you place forward. Once again, you can hold onto a chair or countertop before the 10 seconds begin if necessary to keep your balance and make sure you are safe. Go ahead and move yourself into this position, and we will begin the 3-second countdown and 10-second timer. Awesome job on that last balance position and completion of your first functional assessment. If you are choosing to record your results, you should write down yes or no if you held it for the full 10 seconds for each of our balance positions. Our first one was feet together, second one was semi-tandem, and our last one was tandem. Go ahead and write these results down if you choose to. If not, grab some water, take a short break, and then we will move into our second functional assessment. Our second assessment is the 2-minute step test. This assessment measures your endurance, which is also known as your cardiorespiratory fitness. This assessment will be conducted by establishing safety precautions, explaining how to complete the assessment with correct technique, allowing you to practice proper technique, and then a timer to complete the assessment. For this assessment, you will be stepping in place for 2 minutes. We ask that if you have fallen in the past month or need assistance to stand, that you complete this test seated for your safety. Once again, safety is our number one priority, and we want to make sure you are as safe as possible while completing these assessments at home. For this assessment, you will be stepping in place for 2 minutes and counting the number of times that your right foot comes off of the ground. When you're stepping in place, you want to make sure your feet come at least 6 inches off the ground. To help make sure you are getting your feet at least 6 inches off the ground, you can extend your arms out straight, so they are at or slightly below hip level. If you focus on touching your knees to your hands, this will help make sure you are lifting your feet to the appropriate 6 inches. If you are not comfortable stepping on your own or stepping while standing, you can complete this test seated by moving to the edge of your chair and lifting each leg about 6 inches off the ground. You will still count the number of times that your right foot comes off the ground. Just like when you are standing, you can also extend your arms out to help drive those knees up and get those feet 6 inches off the ground. Before we begin the assessment, go ahead and practice these steps seated or standing to see what suits you best. Just a reminder, if you are recording your results, make sure you write down the number of times your right foot comes off the ground, and if you completed this assessment seated or standing. If everyone is ready, we will go ahead and begin the 3-second countdown and 2-minute timer. Awesome job on that 2-minute step test. You guys crushed it. Just a reminder of what to write down if you are looking to record your results. Make sure you write down the number of times that your right foot came off the ground during those 2 minutes, and if you completed the test seated or standing. Great job. Get some water, take a break, and we'll move on to our next assessment, which is the 30-second bicep curl. Our third assessment is the 30-second bicep curl assessment, where it measures your upper body strength. This assessment will be conducted by establishing safety precautions, explaining how to complete the assessment with the correct technique, allowing you to practice proper technique, and a timer to complete the assessment. You will be curling a dumbbell or household item for 30 seconds during this assessment. For the 30-second bicep curl, you will be using mostly your bicep and forearm muscles, not your shoulder muscles. We ask that if you have pain or limitations in your wrists or elbows, that you sit this test out so you do not further your injury. Safety is our #1 priority, and we want to make sure you are as safe as possible. You will be completing as many bicep curls as you can in 30 seconds with only your dominant arm. Therefore, if I am right-handed, I will only be doing bicep curls with my right arm, with my left arm resting. You want to make sure you keep proper posture throughout the test by rolling your shoulders down and back, squeezing your shoulder blades together. If your chair has arms on it, you may need to move to the edge so that your arm can go into full extension. To complete a bicep curl, you're going to grab a dumbbell or household item in your dominant hand, which is the hand you write with, and begin with your arm in full extension by your side. As you exhale, you will bend at your elbow to bring the weight or item close to your shoulder as possible. Then you inhale, bringing your arm back down to your side in full extension. When bending your elbow, you want to make sure it is glued to your side to ensure a proper technique. For the next 10 to 15 seconds during this video, go ahead and try a couple of bicep curls as you watch the video on the screen for technique to make sure you are doing the motion correctly. Just a reminder, if you are recording your results, make sure you write down the number of bicep curls completed in 30 seconds and the poundage of the dumbbell or household item you use to curl during this assessment. When you're ready, go ahead and take your seated position for our 30-second bicep curl assessment, and our 3-second countdown and 30-second timer will begin. Awesome job on the 30-second bicep curl assessment. If the timer stopped and you were in the middle of a repetition with your hand up by your shoulder, just like the lady on the screen, you will count that as a repetition. Just a reminder, if you are recording your results, make sure you write down the number of times you completed a bicep curl and the poundage of the dumbbell or what household item you use to curl. Grab some water, take a short break if you would like, and we will move on to our 4th and final assessment, the 30-second chair stand. Our 4th and final assessment is the 30-second chair stand assessment, where it measures your lower body strength. This assessment will be conducted by establishing safety precautions, explaining how to complete the assessment with the correct technique, allowing you to practice proper technique, and a timer to complete the assessment. For this assessment, you will be completing as many sit-to-stands possible in 30 seconds. We ask that if you have fallen in the past month or need assistance to stand, that you sit this test out for your safety. Safety is our #1 priority, and we want to make sure that you are always as safe as possible while completing these assessments on your own. You will be completing as many sit-to-stands as you can in 30 seconds. To complete a sit-to-stand, you will need to move to the edge of your chair and place your arms either across your chest or on your hips, as you will not be using your arms to stand up. Once you're at the edge of your chair, make sure your feet are about hip distance apart and flat on the ground to help you stand up. While you are in this postural placement, shift your weight forward, keep your eyes looking forward, and stand up so that your hips and knees are in full extension. Once you feel stable standing, shift your weight back into your glutes and hips to sit back down into the chair. Go ahead and practice a couple sit-to-stands to see how you feel and whether you want your arms across your chest or on your hips. Before we begin the assessment, just a reminder, if you are recording your results, make sure you write down the number of sit-to-stands you complete in the 30 seconds. Once you feel comfortable, go ahead and get in that ready position on the edge of your seat, and the 3-second countdown and 30-second timer will begin. Wonderful job on the 30-second chair stand assessment. If you are recording your results, make sure you write down the number of sit-to-stands that you completed in 30 seconds. If the timer stopped while you were standing, just like the lady on the screen, you will also count that repetition. Whether you completed one assessment or all 4 functional assessments, give yourself lots of credit and a big pat on the back for taking the time to complete these assessments and test your strength and endurance. Have a wonderful rest of your day, and always make sure you stay hydrated, fuel your body, and have fun while exercising. Thank you for following along.